here. But for those of you who don't know me, my name is Amber. And I work for Community Futures Entre-Corp here in Medicine Hat. And I support entrepreneurs in the southeast region of Alberta, connecting them with grants, training sessions, and any other valuable resources that can help grow their business. Along on the call with me today, I also have Clayton Willoughby, who is a consultant for the Government of Alberta, a workforce consultant with the Government of Alberta, and he will be helping us facilitate the Q&A at the end. Yes, you guys are all muted and your cameras are turned off just until the end, but by all means, put any questions you have in the chat. If you need us to stop or interrupt, please let us know. And then last but not least, I'm very pleased to introduce Matthew with VirtuClinic, who is our guest speaker today. Matthew is an innovator, a strong advocate for changing the way people access healthcare, both on a personal level and in his work and in the workplace. His vision focuses on making care more accessible, practical, and supportive for individuals and entrepreneurs alike. Matthew has a deep understanding of the challenges we face in mental health today. He's passionate about helping both employees and employers foster healthier work environments where well-being is prioritized and people can thrive. Through his work, he champions new approaches that not only address immediate health concerns, but also create lasting support systems within your organizations. So please join me in welcoming Matthew from VirtuClinic as he shares insights on supporting and building, supporting well-being and building healthier workplaces. Thank you, Matthew.
Thanks, Amber. I really appreciate the kind words and introduction. And I'm very grateful for each one of you that has taken the time out of your schedules today to join us. It does mean a lot to me, so thank you again. So VirtuClinic is an emerging leader in workplace wellness. And as a complete medical provider, we deliver exceptional results for our clients and for employees through the health and wellness lens. If anything I want to leave you with, it's right out of the gate. The key takeaway today is wellness is a strategic driver. Today we'll talk about how wellness will impact your organizations and the many different ways that using wellness, again, as a strategic driver or a strategic investment versus cost mentality will be able to put your business ahead. So through this, we'll talk about four main areas. We'll talk about employee recruitment and retention. We'll talk about talent pools and how to increase those. We'll talk about reducing costs and also providing a competitive advantage for your business. Again, awesome stuff. I'm really excited. So before we dive in, we need to understand people. People are highly complex. And again, as a practitioner for, well, 21 years now in the industry, people are very complex. And there are things that I still learn today from people, just because, again, you cannot typecast or, pigeonhole anyone or a disease into some sort of box. There's always something to learn. So looking at employee wellness or global health, workplace health, we look at Gallup, who's a worldwide leader in statistical analysis and surveys, and they bring about 85 years of global research and expertise to the world of work. And here's what they found on a daily basis. For people, emotions matter. So 50% of these are for North America, 50% of people experience stress, 17% are plain angry, 22% are sad, and 15% are lonely. We also were able to find how people are in life in terms of thriving, struggling, or suffering. And what's very interesting is that in the yellow and red categories of struggling and suffering, we're almost at 50%, which is huge. Combined with an employee engagement of 31%, we also see that workforces and workplaces are encountering another thing. 50% of people are looking for new work. So what does this mean for your organization? It means that the stakes are kind of high, because at 50% of your workforce, numbers matter, people matter, engagement matters. A little closer to home now. It's been a very interesting couple of years. We are now in this tsunami of AI, and I will gladly advocate for AI. And if your workplace is not using it or does not understand it, grab the surfboard, or else you're going to be lost at sea, so to speak. It's here. We are entering the age of AI. And what it does essentially is it will propel or support businesses, and businesses that are not prepared or utilize AI, they will become outdated very quickly. So let's take a quick snapshot of our occupational, our workforce climate, basically here in Alberta. What's really interesting here is not only 45% of employer labor shortages, obviously that's very important, is that the job tenure is declining. So we started off with understanding people, and now we're looking at millennials and Generation Z, and we'll talk about them in a little bit more detail in a few moments. But when we look at the forecasts for labor shortages, we're seeing that education and law and sales and service, interesting place going to be forward, again, integrated with AI. So for industry-specific challenges, and this is not a comprehensive list, but we selected some of these today to go through. And understanding the problems helps us understand the solutions. So these are some of the things that the industries do face. So healthcare, super high burnout rate, high overtime costs. We've seen a lot of staffing agencies, replacements. Statistics Canada predicts that, or says that by 2026, 24.4% of national nurses will leave the profession. That's due to burnout or retirement, or again, leaving the field altogether. So just from a nursing perspective, that is huge because again, it affects patient care. Again, in a high caring profession, high level of absenteeism. There's a phrase in healthcare sometimes people get to where it's too tired to care, where people are running on fumes, they have nothing left in the tank to give in terms of empathy, you know, and it's very sad if you're there, and it's not fair if you're a patient, because again, you need to have that care. We look at now at the transport industry. Again, recruitment and retention. Temporary foreign workers, again, changing workforces are huge factors. And driver health issues, this is at the crux of it. Schedule disruptions and what happens when a driver is sick. That means that a load doesn't get delivered. So what does that mean for the client? What does that mean for the supplier? What does that mean for, again, the consumer, supply chain? We look at agriculture, seasonal shortages, again, rural workforce limitations, because again, you're out in the farm, and also physical demands of agriculture employees. And we have to also acknowledge chronic health issues. And the Public Health Agency of Canada says that about 50% of Canadians deal with some sort of chronic health issue. Moving into construction, we have obviously a fair amount of injuries. It's an at-risk occupation, high WCB claims, which means that injured workers delay projects, deadlines aren't delivered, cost overages, and so on. And so as you can see, we've got quite a snowball effect happening in each of these industries. And in small and medium enterprises, we're looking at a high churn rate, or, you know, moving on to different employers. And we talk about mental health challenges and productivity losses. So let's talk a little bit about skilled labor and what it costs, because again, we start to understand a little bit of the math here. So let's take a look at a skilled worker, and by definition, we're using $36 an hour. So that means that this person makes $74,800 per year, and they have now decided that they are leaving the organization. Now, let's take a look at saying that by the time that it's taken to find a replacement has been 30 days. And again, it can vary. Sometimes it's shorter, sometimes it's very longer. And again, finding that skilled workforce and finding that skilled employee, sometimes you can be looking for several months. So we all understand kind of like those direct costs, but let's dive into some of those like indirect costs as well. Do we factor in the time? And today we'll talk more about time. So we understand HR manager salary or HR, admin salary, people who are doing that work to get things moving. We look at the cost of advertising, even advertising on LinkedIn, it's very expensive per day. What is the time in terms of doing background checks for, again, qualified people, potential candidates, and so on. And then we have to look at what happens when somebody gets in the chair, so to speak. So the onboarding, the training, what does that cost in terms of the hiring manager or team lead? But now I also want to share with you, or pause to say, what about the time it takes for ramping up activities? What about the displaced workload? And all of these factors have an effect on people's health. Because again, if it takes longer than 30 days to find somebody that's qualified, people are backfilling, people are going above and beyond, but for how long? How long before they redline, as I like to say. So when we look at it, if one person is leaving your organization in terms of turnover, that turnover cost is $28,000 plus. So what happens if you have 5 people in your department and 2 of them leave? Like, that's significant. So, and we can also see the national impact. It's huge. It costs Canadians a lot of money, and Canadian businesses a lot of money, 16 billion plus. We talked briefly or introduced generations, and I'm sure that this is nothing new. We know that workforces are shifting. People retire, people enter the workforce. And so I just want to give a little bit of an overview, because looking at what people value in terms of organizations or businesses that they're joining or job seekers is very important, because when it looks at wellness, what are people looking at? So boomers are more concerned, or historically concerned, on security. You get a job, you stay in it, you got some great benefits, and you have healthcare coverage, and you sit in there and you're good. Generation X, they want more of a work-life balance. I'm not here to put 90 hours a week into working. Again, a little bit of a shift from the boomer generation. People are looking now at family, health, and also career growth. Now we're looking and diving into millennials. They want flexibility. They're demanding flexibility, but they're also looking more about purpose-driven work. And it's one of the important factors when we look at employee retention. Meaningful work is very important. And they're also looking at mental health support. So already starting with Generation X, and even back into the boomers, we're now seeing a growth or more of a demand from a wellness perspective. And with Generation Z, the trend continues. People want rapid advancement, but holistic well-being. So if we take a look on that little graph, what does your organization, or what does your business consist of in terms of a workforce? Are you more Generation X? Do you have more boomers? Is it a mix? Is it an equal mix? So again, from a human resources perspective, this creates a lot of different complexities and how you're going to manage and engage these people. Let's take a look at, again, how wellness trends. Okay, so the good news is that workplaces are adopting wellness programs. So we see an average of about $2.50 to $3.27 and above kind of deal. I'll say that with a little asterisk beside it, depending on the industry. So wellness plans or wellness initiatives are working, and they are on the uptake in terms of employers utilizing them and people utilizing them. And also HR supports these as well, with about 65% seeing a reduction in turnover. So we have to think about this, is that when people are healthy, they're engaged, they're happy, and they're less likely to leave an organization. So the magic is, how do you keep them there? Let's dive in a little bit more to ROI, or the return on investment, the business case. This is what management and leadership always wants to hear about. So I really love this, because when we look at this graph, it says for every dollar invested in workplace wellness, and it actually goes into more and more depth, or more granular in terms of retention savings, healthcare savings, and so on. But what's interesting and is not mentioned is a term called presenteeism, which is when people show up to work. They're there at 8 o'clock in the morning, or the start of their workday, and they clock out at 4 or 5. But for the duration of that, they spend 5-6 hours staring at a wall, staying on social media, chatting with their friends, engaging in a lot of activity that's really not relevant to business at all. Now, don't get me wrong, I love staring at a wall occasionally, and I know that sometimes we all have those days when we're just like, mentally, we've had enough. But when we look at chronic people who are utilizing or experiencing presenteeism, it's a big drain on companies. Let's go into a little bit about expanding the talent pool, because we look at rural workforces and talent pools. We've seen a lot of shift again since the pandemic, the integration of virtual technologies, including virtual health. And when we look at people, again, in different roles, because we're looking them beyond just as an employee of an organization. We're looking at people that are caregivers. We're looking at people that are maybe disabled. We're looking at parents. We're looking at, again, rural workers. So utilizing technology is huge for your business, because it can increase that geographic boundary. So somebody who, again, is located in, for example, Medicine Hat, can work for a company in Edmonton, Calgary, Fort McMurray, Toronto. Again, it depends, but the technology is there, and what companies are doing is utilizing this as a strategy in order to widen their talent pool and widen their reach. So we're seeing more about work-life integration. Again, that's the beauty about a hybrid or a flexible work arrangement. And we are seeing that companies who utilize this have about 90-kilometer on average reach in terms of geographic advantage. So let's take a look at how VirtuClinic fits into the picture and how we excel for our clients. So through wellness, we save our clients a lot of time and a lot of money in wasted productivity and health-related downstream costs. And we actually measure the ROI, and we are huge in terms of justifying and proving what the data says, because we utilize this data and we can use it with our clients to forecast or use it for future decision making, rather than just making a bold claim of, we'll come in and save you some money. Well, how are we going to do that? So we are a complete workplace wellness provider, and we are a complete solution. So we have full medical privileges. So we have nurse practitioners, mental health professionals, registered provisional psychologists, registered nurses. And what we're able to do is have the benefits and authorization of a full medical clinic, including specialist referrals throughout Alberta, and again, providing timely access. So a lot of our access is about same day or next day. I'll use an example of mental health here in Alberta and a little closer at Medicine Hat as an example. So typically it takes about 10 to 12 months for somebody to receive a psychiatrist referral. That's again, if the psychiatrist accepts the referral. But let's back up a little bit. How do they get access to healthcare in the first place? We know that 25% of Albertans do not have a consistent provider. At a walk-in clinic, is the practitioner or the facility going to provide that referral? That's a big question mark. Where with VirtuClinic, we handle all of that. We're comprehensive, and again, we're an ecosystem, if you will, of prevention, treatment, and also dealing with post-injury and WCB return to work. So by integrating mental health, physical care, we've streamlined and reduced time. So again, there is huge value in this. And going back to this example of waiting for this referral to take place of 10 to 12 months, we can actually have a patient who has reached out to us, and we can, if, for example, if medication is needed, have them fully managed or on the start to management after seeing one of our mental health professionals and one of our nurse practitioners within 2 days. So we've gone from waiting 10 months dealing with some mental health crisis or situation down to getting the ball rolling, so to speak, in 2 to 3 days. Like that's huge. And now think about it from a personal level. If somebody were experiencing mental challenges, like that would be a lifeline. And we're really proud of it. So again, what we do is we utilize data analytics, and more importantly, we have to understand that we live up to the ROI. We're definitely financial stewards, and we are passionate about making sure that we deliver value. So let's look into the WCB part of what we do. So we are an authorized WCB provider for Alberta. And again, the great thing is that we provide virtual care all across the province. We know that the statistics in Alberta say it takes anywhere between 3 to 8 hours if somebody with a non-emergent health concern or workplace injury goes into emergency, and they're triaged as low triage because it's emergency department. So people typically tend to wait. General workplace policies also say that the injured worker has to be escorted by another employee. What we've done is we've actually, eliminated that. We can see somebody in as little as 30 minutes. We can get them started. We provide the treatment plan, we provide the follow-up plan, the communication plan, and also we complete the first report for my WCB. So we've taken this process typically, so let's walk through it for a moment. And this is my experience as an occupational health nurse as well, coming into it. We have an injury on site. You take the injured employee again and the escort to emergency. You complete the report, or should I say the physician in the emergency does it. And then you return back to work, realizing that, guess what? The paperwork isn't filled out properly. Because also think about it this way. Emergency physicians are not there for WCB cases, they're there for emergencies. So it's using the right tool for the right job. So now we have to wait for the medical doctor to come back on shift, and then you have to complete the paperwork. Meanwhile, you're also bound by the time and the responsibilities from WCB. So now you're able to get the information, you complete the first report, and now whoever is tasked with finding another health practitioner to follow up and arrange next appointments and communicate, it becomes such a huge process. It becomes such a time process. And we look and said, you know what? We've analyzed this and we've said it takes about anywhere between 16 to 25 hours worth of labor to do this. By utilizing the VirtuClinic process, we right out of the gate save 50% because we don't need an employee escort. We're able to see somebody assess online. And again, through our medical privileges, through our clinic, we're able to provide referrals, we're able to provide reports. We are net care or provincial healthcare records authorized, which means that we have met security standards and protocols through the Ministry of Health and also through the Office of the Privacy Commissioner of Alberta. And again, we expedite and get that WCB claim started. This means that people get treated faster, they return to work faster, and there's less cost for the employees. One of the other benefits or pain points that we've heard from people is that whoever's doing the follow-up in terms of contacting clinic number 1, 2, 3, 4, and 5 is that information doesn't necessarily get translated very quickly. Primary care clinics are overrun. You know, who's going to quarterback or who's going to field the medical care? And when it comes to VirtuClinic, we handle all of that. We have all of the records centralized and we have the access. So basically, we're able to streamline that care. We look a little bit here, some data from kind of the last year or so. We've been able to make an impact in terms of absenteeism, turnover, and employee satisfaction. So what happens, because this is a common question, we'll talk about this in a moment, year over year improvement, right? We look at before, after 6 months, and after 12 months. That's a great snapshot period. And our employers, that's typically what we deal with in terms. We see these results kind of, you know, decrease, and then also turnover rate, we're decreasing, and then also we're seeing employee satisfaction through HR culture surveys and other HR tools and metrics. They're also increasing. So we're demonstrating that, you know, there is ROI there. We're showing that, you know, people are not turning over. And this was interesting again, because what we don't show, again, just because we haven't done this particular field for 20 years, is that the longer that, you know, a company is utilizing VirtuClinic, is that we're actually able to dial up their ROI. So what does that mean? It means that we give results, we deliver results, and the longer that we can do it, the more benefit that we can provide for the workforces. All right, enough of this hypothetical stuff and, you know, all these charts. Let's look at Dave. So Dave is obviously a fictitious person, and I wanted to share a real story with you today. So Dave is a trucker, long haul, short haul driver, from rural Alberta. He's got 15 years of experience, primary breadwinner, and again, mentioned that 50% of Canadians approximately have a chronic health disease. So we took a little bit of a snapshot and followed Dave for a little while. So we looked at chronic back pain due to occupational stress. So for example, long hours of driving, it's a job demand. You can't really get away from it. Although I am understanding that they're piloting driverless transport vehicles. Very interesting to watch, but that's just an aside. So Dave's been in pain for a long time. He is now at risk or developing depression from being isolated. Dave is now starting to miss more work. And obviously there's a strain on family relationships. So this is fairly common. And again, we can use this kind of symptoms in different industries. And again, this isn't just about the patient or the employee. Illness affects families and it impacts relationships as well. So we've now had an opportunity to work with Dave for about 6 months. And again, so through, you know, regular, mental health, mental coaching, nurse practitioner involvement, referring to allied health professionals as needed, physio, again, to strengthen the back and so on. We tracked Dave in terms of what he was able to do. And he had reported approximately almost 2/3 of, a reduction in absenteeism or sick days. His pain actually got a lot better. So what's happened is his sleep improved as a result, and his depression symptoms resolved. So what does this mean for Dave and the business? So Dave was able to avoid a WCB claim, again, due to occupational stress and injury. Dave did not miss any deliveries, so Dave's employer is pretty happy And guess what? Dave still has a job because Dave's reliable. So what the real value here is having the ability to access the team from VirtuClinic anywhere across Alberta. You need an internet connection and a mobile device, such as a computer with a camera or your cell phone. And again, it's that easy. So what Dave has been able to share is that really this is the stuff that really we love, because Dave, his pain is managed, he's sleeping better, his relationships are better. Like that's the stuff that matters, because at the end of the day, like I said, we're all people. And in order to succeed in business, we have to understand people, and that's what we're about. So moving a little bit deeper into implementation and talking about how VirtuClinic is able to support organizations, supporting them through culture change and culture shift through wellness. Today, we've explored many complex factors that organizations deal with in a relatively short amount of time. It's been about 30 minutes. We look at, factors of or concerns of employee engagement, turnover, production, expanding or shrinking talent pipelines, geographic locations, ROI, and, just to do a quick recap. So when we look at what's important is relationships, and that's what we are very proud of with our clients, and that's what we offer everyone, is clear communication and relationships. These are central tenets to our daily work, and that's what we hold true to. We believe in partnership and co-design, which means we don't have this cookie cutter program. It is highly developed with the organization. So we're able to measure what they want to measure, and we have KPIs, and we are able to find and track those metrics to a co-design program that creates really a win-win for everybody. Because if the organization is disconnected and leadership is not on board, or there are no KPIs defined, like how do you move forward? How do you measure success? So we make sure that we clarify and create that roadmap together with our clients as we go along. And reporting and education is ongoing. So this is the beautiful part. We're able to utilize, again, data to provide evidence-based decisions and future planning, but also when it comes to identifying themes. So for example, let's say there's a high utilization of mental health services. Well, maybe that means that, the company or our client would be interested in doing some more mental health education. Now, what does that mean? Again, that's a development for what works best for the company. If it's a distributed workforce, electronic means would probably be the best. But again, it's co-designed. And the end result is shifting this culture. We're moving away from a culture of, ouch, I'm hurt, to, hey, I'm not feeling myself today. And how can I get better? Again, this is what Generation Z is typically saying. This is what millennials are typically saying. They're not waiting for, again, injury to happen before seeking help. That being said, we are also very aware of privacy and access. So one of the other features or services that we provide are digital health advisors. So this is a brand new flagship product that we have, and it provides 24 hours, 7 days a week, accessible, reliable, trusted healthcare advice and navigation. Now, when certain people phone certain phone lines, they may or may not be available and may be directed to a certain emergency department, even though their symptoms are not necessarily emergent. So that means that there's a big piece of triage missing. So we've been able to incorporate and develop through years of R&D, actually 3 to be exact, to create these digital health advisors, and they are something very interesting. So please reach out if you want to have a chat about that as well. So again, co-design, providing something that works, and making sure that the health and wellness of your workforce is where we're at. That's exactly where we want to be, and that's where the magic lives. So through the lens, again, of wellness as a strategic driver, reducing costs for organizations, retaining people, attracting workforces, because again, people talk and they will gladly promote your employer brand if you're taking good care of them. But on the other side, if you're not, then I think people also understand that too. So what does that really cost your organization in terms of brand reputation? Something maybe to think about today as well. So again, through wellness, we're strategic in terms of how we deliver value, and we prove it every single day with our clients. So I want to open up the conversation now to have more of a discussion. It's always tough where you just sit there and listen. Please be an active contributor, ask the questions through the chat, and I'm hopeful that we can support and answer those questions. So I've created a few common questions that we typically will get, such as how quickly do companies see ROI from wellness programs? In terms of the data, something usually takes around 6 months to start taking shape and identifying themes. Because again, when you first launch, you might have your early adopters, you might have your late adopters. So again, there's it's a very flexible data set. But again, by 6 months, usually it's tightened and more stabilized and again, more reliable. So again, typically achieved within the first year. I did also mention earlier in the presentation that when we have more and more or a longer contract relationship or relationship with a client, we're able to, show those savings more and more. All right. The other question is, what does onboarding process look like? I know we all love how long meetings take. I'm kidding, of course. So we believe in being responsive and communicating, again, like as previously mentioned. So from kind of contract signing and starting that, official relationship, we can actually get started within, 2 to 3 weeks. Again, this is all taken care of, and we agree on dates together so that we are all on the same page. And again, how do we measure program success? We're not just promising the moon. We track the KPIs. We look at what's important to your organization. Again, such as absenteeism. What are WCB rates? What are WCB claims? What's employee satisfaction, so on. And those are the start of where we go. And again, every organization, every business is different, but this is where we excel and are able to help and support people. So I want to open it up again. Questions, feel free to put them in the chat. I'd love to hear anything that maybe your organization is doing or that you really love, and let's take it from there.
All right. Well, I'll jump in to kind of facilitate the Q&A. If you have any questions and you don't feel like speaking, you can put in the chat. If you do have questions, you can just raise your hand. Should be just a little icon there. You just click that, and then I'll be able to call on you in order. Amber.
Me first. How does an employer subscription work?
Yeah, so an employer subscription work is essentially we have a defined term. Usually it's a year to start kind of deal. And again, it can be longer, again, depending on what the outcomes would like to be. And again, agreeing on what a reasonable timeline is. So an employer subscription essentially means that they've subscribed to a certain amount of hours of support, and they're all allocated towards that employer. So families, again, employees, families, we have, again, like a secret code, again, to make sure that we have the proper account, and we monitor utilization from there, and that's how we determine trends.
Awesome.
Well, while we're waiting for people to kind of get their questions together, I've got a few for you. So you did share an example of Dave, but what other feedback have you received from the employees that access the health services?
Quite honestly, it's huge. So social proof, ratings on Google, it's great for us, but it's not the defining factor. But what it shows is consistency. What we hear from people over and over again is they're blown away by the standard of care and the level of care that we're able to deliver. Typical healthcare providers will say, hey, we got time for one thing only and that's it. And then you have to make an appointment for another one. Where we're able to take that time, we're able to explore more in depth. And again, we have the data and the authorization from the Ministry of Health to have a complete picture of your healthcare even before you have an appointment, so that we get right to it when you hop in, and we're able to provide a clear action plan and to provide service to get you on the road to wellness. So our service level is unmatched. We have converted, so to speak. Other people have used other telehealth providers, and they definitely have chosen VirtuClinic just because of the way that people are treated. And this is the way that we deliver healthcare.
Okay, so on that, as far as like employee experience, which is kind of the tone of these next couple questions, how do you think younger employees view virtual health compared to traditional models?
It's interesting because, again, there's more of a conversation around it. So again, culturally, it's more acceptable to say, I'm not having necessarily a great day, or I'm not at 100% today. I'm going through some stuff, like, can I just have a little bit of space or grace, if you will? The other part of it is digital health. So utilizing our digital health advisors, again, it's something that there's no data track, there's no information, it's 100% private. There's comfort in knowing that it is private. And so, for example, if somebody's really utilizing or dealing with a situation, and it can be a very serious situation, there's something that is private and it is digital and, again, verified for trusted information that people can ask. So it's another tool for young people. And again, in terms of adoption, we're seeing people utilize, again, the virtual clinic itself and also our digital health advisor. So again, it's meeting the needs of where people are at. Does that answer your question?
Yeah. So Tracy just asked a question. Does VirtuClinic help with health policy / process development?
Yeah, absolutely. Again, this is about shifting culture and looking at processes. And sometimes, again, let's look at that WCB process. If you're utilizing 2 people for a non-emergency WCB claim, well, maybe it looks at process development, and we've worked with our clients before to kind of tailor this and then share it and communicate it. So yeah, we definitely do that. Yeah.
Okay. There's a question being typed right now, but while we're waiting for that, so as far as implementation, what challenges do employers face while trying to offer health supports to their employees, like as far as implementing a program? Kind of, we talked about culture a little bit and helping the employer through that. So what are some other, if any, challenges do you see employers face, and how do you help them with the implementation?
Yeah, great question. The biggest challenge is that when we find out that there's a disjoint between, let's say, who we're speaking with, let's say, again, for example, HR versus leadership. If leadership is not on board, or leadership is not in the same information flow, then it makes it a huge challenge, because, again, we're expecting, and how we design it is that leadership models it. So leadership not only approves that process, but leadership walks the talk. And for that is huge for people, that is huge for organizations. And that is a major cultural lever or switch. When they see that leadership is doing this and implementing it and living by it, that's when you get everybody else falling in to support it.
All right. Oh, okay. the three dots pops up and goes away. So I just wanted to give someone time to type. But if there's no other questions,
Melanie has a question in there. Or did you get that one?
is it in there, or is it in the Q&A, or is it in the
It's in the chat.
Oh, it wasn't popping up to me. All right. Can you describe the onboarding process for new employees to increase their comfort to engage in these benefits? I'm thinking about young people new to the work world who just don't realize what they have and how to use it.
Yeah, we really work on a communication plan with, for example, if we're working with human resources as one of the stakeholders. So not only are we creating a process, but we're also creating a communication plan. Because again, what does your workforce look like? Is it people that will read emails? Is it people who look at little snippets of video? How do you typically share organizational updates or important updates with your team? So communication is huge, and it's not a one-time thing. So that's a strategy in itself. And so we work with the organization to make sure that we're delivering the right level of communication at the right frequency. Again, especially for organizations that, have shift workers that run 24/7, where they're, working in they're a dispersed workforce. Again, like they're not just in a centralized office.
Okay, got the three dots. While waiting for that, let me just pull from my questions for you. So has the question come in? Apparently my chat isn't working super great.
No, it's still.
Oh, okay. All right. Okay. No, you've answered those questions. Well, you're answering my questions with your other ones. But oh, thanks so much. I have to run. Oh, okay. All right. It's a goodbye from Tracy. All right. Bye, Tracy.
Bye, Tracy.
All right.
I'd just like to lean in on that scheduling issue of really how important that is. And I don't even think it's just young people. I think it's everybody. If you're a shift worker, and I know, I had this experience with my daughter and your clinic, and she gets her schedule very late. She doesn't have, an entire month. And then so when something comes up and she's trying to plan a doctor's appointment, it's incredibly hard to get in. And then she's like, but I don't know that they're going to schedule me or give me the time off and this, that, and the other thing. And I was like, I had set her up with VirtuClinic, and she's like, I just didn't know I could do that, and had the most wonderful experience, and met with a nurse practitioner in the evening, and it just solved her issues in the day. You know what I mean? And I think that goes a long way, not just, for our youth, but millennials, boomers, anybody working on a reliable shift schedule. Yeah.
First of all, thank you very much for sharing that. I'm so happy to hear that. And this is what I love about what we do, because first of all, we have an amazing team, and at the forefront is about people. So when we've designed this entire system, the VirtuClinic, our Ready Care model, we've designed it with people truly first. So what people are able to do, again, is choose a provider that works for them. So that's really good. You're not stuck with one person. If you have, again, for an example, mental health challenges or questions, we have mental health nurse practitioners that are specialists in this, where maybe you have endocrine or hormone questions, or, again, it's tailored. The experiences are tailored to what you need, or for what the patient needs, or what the worker needs. So you're not stuck with one person. That's one of the things that we look at the current system and say, but why? So again, this is where we are a departure from that traditional thinking. And again, now when it comes to scheduling, you are able to pull it up and you choose the time that works for you. We're here. We don't run 3 hours late. If we have an appointment at 10 o'clock, we see you at 10 o'clock. And that's, again, something very, very rare in healthcare. So again, it's all thanks to our awesome team who keeps all of this running and just does an amazing job. But thank you so much for that wonderful, wonderful comment.
All right. There are no other questions coming in. We're 8 minutes before end time, but I think we can call it. It's the last chance for questions. If not, then everyone have a good day, and thank you so much, Matthew, for the presentation and the information.
Thank you so much. I'm really glad. Thank you again to everybody that attended today.
Matthew, how could everybody get a hold of you if they had some questions?
Absolutely. That's a great one right there. There's my contact information. You can reach me via email. Our office phone is right there, and just follow the prompts. And again, one of the benefits of joining today and participating today, if you want to have more of that conversation, you know, I'm interested to continue a dialogue and give you a little bit more of a service here for you in terms of a wellness assessment. So you're able to schedule and discuss. The QR code will also lead you to our website. We'll give you more information. And just before we leave today, I do want to say thank you very much for those who could make today possible. Community Futures, Entre-Corp, thank you, Amber. The Government of Alberta, Clayton, I really appreciate it. I know that Josh from the Alberta Motor Transport Association is, I believe, here today. Thank you again for promoting it through the membership base. So again, let's work together. Let's change the future of work. Let's utilize wellness to really impact businesses. So thank you very much.
Thank you very much.